So just some very basics with the Alaris pump and a basic IV setup. So we'll assume we've already primed our line and we've got the Alaris pump here and the Alaris tubing. So we go blue to blue. And put that right up in there. This one down there. And you know, it doesn't take much to close this. You shouldn't have to force it, otherwise you might be breaking it. There it is, it's closed up. And we turn the machine on. We'll do a very basic setup here. One where we're just setting, let's say we were going to run a basic infusion and a secondary infusion. So a primary and a secondary infusion. What would be the basics of setting that up on the pump? We can get more advanced in terms of entering med names, but we won't worry about that right now. We'll just get the basics going, like if you're running a bolus or something like that. So we could say new patient. It's med surg, sure. And then we go confirm. We don't need to have a patient ID at VCC. And then, so we're gonna start with channel A. And we just pick basic infusion. When you're out in the hospital and you get trained, they will train you how to enter drug names or pick the drug names, and that's just one little extra step, but we don't need it right now. So we go to basic infusion. There's our primary, and let's say the primary is gonna be a TKVO rate with a peripheral IV, so we can say 25 cc's. Okay, then volume to be infused, whatever the size of the bag is. Say there's 800 left in there. So that would be fine, and we could just press start and start our primary infusion running. That would be all there is to it. But let's just say, for example, we're running a secondary as well. Maybe it's an IV bolus, non-medicated, which LPNs can do. Then we pick secondary. Of course, we'd have to set that secondary line up physically, but assuming that's being done, that's a separate skill video. Then we're just going to run it as a basic as well. Secondary, say it's works out to be 500 cc's an hour. Volume to be infused, say we're doing it over 2 hours. And I press start and it starts to run. And when the secondary is done, it'll automatically flip on over to the primary, which is set at 25.